So in previous class, we discussed about uh, kidney stones or renal calculi. Okay. Today we'll discuss very important subject that is important topic that is polycyst kidney or cyst in kidney. So let's discuss about. So basically, cyst. What is cyst? Cyst means it is a accumulation of fluid in a pouch. Accumulation of fluid in a pouch or in epithelial tissue. Okay, this is cyst. So basically, it may be due to the infection. Okay, sometimes it is cause is unknown. Okay, sometimes it will damage kidney parenchyma, mean kidney cells, nephrons. Okay, so these are the reason behind the cyst. Okay, what is cyst? Cyst is the uh, fluid accumulation of fluid in a pouch or epithelial tissue, okay, which is present in the kidney, sometimes bladder, uh, okay, sometimes prostate, or in the female, mostly in this is in ovaries, okay. So it is initially it will due to the infection, or sometimes it is hereditary also. It is hereditary disease also. Okay, mostly it can be seen in between the 30 to 50 or 60 years age. Mostly it female, mostly more than male, female ratio are more. Okay. So what are the symptoms? Clinical symptoms. We have pain in kidney region or lumbar region. Okay. And second is if there is larger amount, more larger amount. If it is small in size, then the pain is simple pain is will occurs, mild pain will occurs. If it is large, so what will happen? The pain will high. There is high pain, first thing. And second thing is there is a chance of hematuria due to the rupture of capillaries or arterioles, venules. Okay. So hematuria. And another one is the patient have polyuria. Okay. Frequent urination. Okay. So this is very uh, important. These important things you have to remember. So what will happen? The patient, if you not treated, the kidney size will increase and the renal parenchyma will damage. Okay, so the size of the kidney increases, and sometimes the blood pressure will increases not treated. Okay, and if it is not treated, it will blast. What will happen? The renal, and it will the toxins will spread all over the body. It may cause toxic toxicity or okay. These are the things we have to remember. Okay, so patient have pain in kidney region, hematuria, and polyuria. Okay, and increase in BP can see, and if it is not treated, the kidney size will increase, enlargement of kidney, and the last thing is that you can see the patient will have if it is burst, what will happen? The toxicity will spread all over the body. Okay, maybe have sepsis, maybe have sepsicity. Okay, and all over the body, the infection will travel and will damage the CNS. Okay, and it will damage the cardiovascular system or urinary system. Anything will damage, and patient will die also if it is not treated. If it is due to sepsis. Okay, so you need to careful about that. And what are the diagnostic? You have to check the. Sometimes you need X-ray of KUB, kidney, urinary bladder, and you need CUE for the infection, and ultrasonography, USG abdomen or whole abdomen. Okay, this is the thing you have to remember. So these are the things. Initial assessment, initial diagnostic, uh, advisable things. Now come to the part of treatment. What is the remedies you can give? So here we will give S6L1BE and C6A2N1G. Okay. And if the patient have infection, you need to add C1, Ver1, YE. Okay. If the patient have fever or anything else related to infection, you need to add fever drops also, F1, A3YE. Okay. In D6. And to remove the toxins, the fluid accumulation, S6C17YE or only C17. This much medications you have to advise in mostly D5. Okay, if it is fever, you can add D6. This is fever drops. And the last thing is for application. Okay, you have to apply the remedies. Okay, mostly B S6 C17 B. You can advise to patient or only B initially, then after G can advisable to the patient to apply on the pelvic or abdomen region or lumbar region. You have to check if it is right side GE, left side, sorry, right side BE, left side G, or alternate with W oils. Okay. So this depend upon the condition, how much amount of cyst is present in the and which area. Okay. So this is all about uh, cyst. So cyst, you can see that this is due to the infection or sometimes it is unknown. What is the cyst? It is the accumulation of fluid in epithelial tissue. It will damage parenchyma of kidney. Mostly you can see in 30 to 60 years of age, and sometimes it is hereditary also, by birth also. Female having more than male. Okay, and you can see the clinical features, clinical symptoms, the pain in kidney region, hematuria, polyuria. If it is breakdown, what will happen? Toxicity will happen, and toxicity will leads to very serious issues like sepsis. Sepsis will happen, and your CNS, CVS, or urinary system will damage. Then the patient will die. Okay, so this is initially it is not serious issue. Gradually, it will become serious issue. What are the diagnostic tools? You can use X-ray, CUE, USG whole abdomen. Okay. And this is the treatment plan in the initial stage, later stage or serious stage needs careful observation or sometimes need hospitalization. So S6L1BE, all these are in D5, CC6A2N1G to remove the accumulated fluid with the help of manuals. Okay, G also. This is structural remedy. Okay, and if it is infection is there, you can add C1 where when you do CUE, you can see the pus cells Pus is positive. Positive means there is infection. You need to give antibiotics. C1 where one Y. Okay. And we have fever. If it is fever, add F1 A3 YE. Okay. And if to remove the toxicity with the help of urine, we add C6 or C17 in enough for us. Okay. So this is all about polycyst in kidney. So one topic is remaining, that is renal failure. We will discuss tomorrow. We have acute renal failure and chronic renal failure. We will discuss tomorrow. Then our urinary system classes will complete. Okay, these are the important clinical conditions. You may get regular patients of this. That's the reason I am explaining all this. Okay, if any doubts, kindly ask.